everyone. Thanks for joining me for ACEP's Capital Minute, a look at what's happening in Washington right now that's affecting emergency physicians and patients. I'm Laura Wooster. For the next 30 or so minutes, I'm going to give you an update of what's happening in our nation's capital, and then we'll open it up for questions. You can submit them at any time by using the Q&A feature at the bottom of your screen in Zoom, and then I'll answer them live after my update. So today, we'll cover President Biden's COVID vaccine rollout plan and executive orders, what we can expect with a new Congress and a status update on COVID relief legislation, an update on the X-waiver, and other regulatory updates such as major rules released by CMS in the final days of the Trump administration. It's a new day in Washington, D.C., and anytime a new administration gets started, there's an adjustment period. From the top down, that means staffing and policy changes and broadly adapting to a new advocacy environment. The renewed energy in D.C. is unmistakable, and the Biden administration has hit the ground running. So let's take a look at what the new administration has set out as its roadmap for slowing the spread of COVID-19. Amongst a slew of executive orders and day one priorities, the Biden administration released a detailed plan for increasing federal involvement in COVID relief. This 200-plus page COVID priorities document lays out an ambitious 7-point plan to ensure all Americans have access to reliable and free testing. This includes an investment in more drive-through sites and at-home tests, fixing PPE problems. President Biden intends to fully utilize the Defense Production Act to galvanize manufacturing and coordinate and expedite distribution of sorely needed masks and other supplies. ACEP has been calling for this since the beginning of the pandemic. Providing consistent, evidence-based guidelines for communities, schools, small businesses, and families. Planning for effective, equitable treatment and vaccine distribution. The administration just announced a $25 billion vaccine manufacturing and distribution plan that we will highlight shortly. Protecting older Americans and those at high risk. This administration is making it clear early on that addressing health disparities is a priority and will establish a task force specifically to address these challenges and promote equity in the public health and economic response to COVID-19. Rebuild and expand defenses to predict, prevent, and mitigate pandemic threats. You may have heard already that the U.S. has rejoined the World Health Organization and will increase global coordination to better prepare for future outbreaks. And lastly, immediately require masks on domestic forms of transportation, including airplanes, trains, and buses, and require negative COVID-19 tests, quarantining, or combination of those for entry into the United States from travel abroad. In a notable contrast to the previous administration, Biden will take additional steps via executive order to establish a COVID-19 pandemic testing board to look at testing costs and implementation, call for stronger protections for worker health and safety through the Occupational Safety and Health Administration, or OSHA, and at the state level, task the Department of Education with identifying actions to assist in the safe reopening of schools, and establish a COVID-19 health equity task force that will identify actions to ensure equitable response, including those to address vaccine hesitancy. We are going to watch closely as the administration will require an inventory and assessment of the public health supply chain to identify areas of need. And other executive orders aim to enhance COVID-19 data collection, including research on treatments, and strengthen the public health infrastructure. ACEP looks forward to this robust federal response and is actively engaged with the White House, Congress, the CDC, OSHA, and others involved in making sure that emergency physicians' needs are prioritized and addressed, as well as those of their patients. This administration has made it clear that it will prioritize efforts to get as many people vaccinated as quickly as possible. You've likely heard of the plan to vaccinate 100 million people in the first 100 days of the administration. That target is actively moving, and most consider it a starting point, not a finish line. We are told that we can expect a concerted effort to ramp up the vaccine supply and increase the number of vaccination sites. FEMA-run vaccination centers staffed by the National Guard will be set up, and mobile vaccine clinics will be deployed in an effort to target rural and underserved patients. The administration is also committed to enhancing the role of local pharmacies and to allow direct access to the vaccine by federally qualified community health centers. Funding for a bold public education effort has also been outlined. ACEP will continue to look for opportunities to educate the public and limit vaccine hesitancy. You may already have seen the public service announcement on TV that ACEP developed in partnership with the American Nurses Association, American Pharmacists Association, Pfizer, and others. The short video is available on our public-facing Vaccine Information Center, which lives at emergencyphysicians.org, alongside an FAQ and other regularly updated information for patients. For ACEP members, our public relations team has developed a regularly updated vaccine advocacy toolkit to help guide conversations with local media and others. That toolkit and other communication resources live on the ACEP Media Hub at acep.org/acep-media-hub. Members of Congress are adjusting to a new normal and getting set to discuss a full legislative agenda for the 117th Congress. In the Senate, they are currently working through how to proceed under the new power sharing agreement, and that includes determining the rules that will govern the upcoming impeachment trial, which is slated to start February 9th. Whereas in the House, subcommittee assignments are being announced. Many of these leaders will have an important role in decisions that impact ACEP policy priorities. An important congressional committee with jurisdiction over healthcare and physician-related issues is the House Energy and Commerce Committee. ACEP works closely with members and staff from both sides of the aisle on this committee, in particular those offices on its health subcommittee. Representative Anna Eshoo, Democrat from California, will chair the House Energy and Commerce Health Subcommittee, while in a surprise move this week, ranking member of the committee, Representative Kathy McMorris Rodgers, Republican of Washington, named Representative Brett Guthrie, Republican of Kentucky, as the ranking member of the Health Subcommittee. In doing so, she bypassed Representative Michael Burgess, Republican of Texas, who is also a physician for the position. Additionally, the Biden administration is working with Congress on drafting legislation to implement Biden's plan for another COVID relief bill. As physicians and others seek additional relief, there is another funding package under discussion. The $1.9 trillion proposal has initially run into bipartisan opposition, especially surrounding the additional stimulus payments for individual Americans. There is reluctance on the part of some Republicans to move such an expensive bill, which could prove problematic in the closely divided Senate. Remember, right now, Vice President Kamala Harris holds the tie-breaking vote in the Senate as it's evenly divided between Democrats and Republicans. One option would be to move the bill once it's actually written under regular order, but that is a lengthier process with less certainty for success unless Senate Democrats do away with the 60-vote filibuster rule. An alternative option may be to move it through the budgetary reconciliation process, which would allow it to pass with only a 51-vote majority. The Biden administration is currently weighing options on how to proceed in this work with Congress. And speaking of the administration, HHS issued a January 15th update to the Provider Relief Fund reporting requirements for those who receive more than $10,000 in accordance with the Coronavirus Response and Relief Supplemental Appropriations Act of 2021. The notice offers details about data to include as part of reporting requirements and stipulates that if recipients did not expend their PRF funds in full by the end of calendar year 2020, they'll have an additional 6 months in which to use remaining amounts. The details, including registration and audit information, are posted on the HHS website on your screen. In the waning days of the Trump administration, HHS has made changes to the X-waiver requirements for MAT in order to allow emergency physicians to dispense up to a 3-day supply of buprenorphine at one time to a patient suffering from acute withdrawal symptoms. Then, in an additional move celebrated by many physicians and health advocates, including ACEP, they essentially got rid of the X-waiver requirement altogether for emergency physicians and drastically scaled it back for office-based physicians. ACEP had been advocating for these changes with several other fixes to make it easier for emergency physicians to administer buprenorphine, so we applauded both actions. But the excitement was short-lived as the Biden administration promptly enacted a regulatory freeze with the intent to review every regulation that was passed or pending in the home stretch of the previous administration. As part of that regulatory review process, concerns have emerged that HHS may not have had the authority to change the X-waiver requirement so drastically. ACEP jumped on this and quickly organized a letter this week from 16 medical associations and other organizations, including the AMA, which was sent this morning to acting HHS Secretary Norris Cochran. Our letter outlines the importance of emergency physicians' access to buprenorphine and requests that HHS finalize the practice guidelines that effectively eliminate the X-waiver requirement for emergency physicians and others. The letter is available online at the website on your screen. It emphasizes that while we understand there may be some challenges with finalizing these guidelines in their current form, we ask that HHS continue to strive to send them to the Federal Register as soon as possible, given the alarming increase in overdose deaths during the pandemic. We hope to get more information about HHS's rationale and will encourage them to do as much as possible to help emergency physicians treat patients who struggle with opioid use disorder. We'll keep you posted as this develops, and you're encouraged to reach out to me at lwooster@acep.org or ACEP Director of Regulatory Affairs, Jeff Davis, at jdavis@acep.org with any questions. The Centers for Medicare and Medicaid Services, or CMS, issued numerous final regulations, some of which came only a handful of days after public comments were due on the associated proposed regs. By law, federal agencies, such as CMS, must consider public comments from proposed regulations when drafting final policies. The short timetable between the public comments deadline and the final regulations released is part of the reason why the Biden administration wants to review all of the changes that the previous leadership squeezed in at the last minute. The latest installment of ACEP's regulatory blog, Regs and Eggs, offers a deeper dive into the regulatory actions CMS took in the final days of the last administration. For example, last Thursday, CMS issued the final 2022 Notice of Benefit and Payment Parameters. This is the annual notice that governs policies around private plans on the ACA exchange. In the notice, CMS makes a number of changes that ACEP and other stakeholders weighed in on. Comments on the proposed notice were due on December 30th, just 15 days before the final notice was released. CMS issued the major regulation last Friday that imposes new requirements for certain health plans, excluding Medicare Advantage plans, to improve the electronic exchange of healthcare data and streamline processes related to prior authorization. It requires increased patient electronic access to their healthcare information and would improve the electronic exchange of health information among payers, providers, and patients. That reg was finalized in just 11 days. There are also new rules governing Medicare Advantage and Medicare Part D private health plans, and a rule for a new Medicare coverage pathway, Medicare coverage of innovative technology for breakthrough devices. Finally, CMS issued its Medicare Advantage and Medicare Part B annual rate notice last Friday, a full 3 months earlier than the annual notice is typically released. We can expect all of these to be reviewed by the new administration. ACEP will be watching closely to see how the Biden administration approaches each of these regulations and which versions of the policies will ultimately be finalized. That wraps up this week's Capitol Minute. As a reminder, this episode and all others are available anytime at acep.org/Capitol Minute. Now, I'll be happy to take your questions. Remember, you can submit them using the Q&A feature of Zoom on the bottom of your screen. All right, let's see some questions coming in. This one says, you mentioned the Provider Relief Fund. What have you found is the most effective way to communicate the urgency of relief to Congress? So we've done multiple letters, both to HHS and to Congress, just talking about the urgent need for relief and providing examples. And really, I think the best way to continue to communicate the urgency of the need for relief is to tell your story and just talk about how the pandemic has hit you and your practice economically. That's the kind of most compelling information that we tried to gather data for. And there's different ways to communicate that. But one way to do it is to talk to your local media. And you can use some of the COVID-19 toolkit materials that we have posted on the ACEP Media Hub to help you prepare for that. Let's see if there's additional questions coming in. That's quite a lot of aspiration from the new president. What do we think is most achievable and what is most challenging? It definitely is a kind of pretty exhaustive list, but that's kind of typical for a president, incoming president. Usually the first 100 days, that's why we always talk about the first 100 days, are their kind of easiest window to get something done. That's before things tend to get completely kind of jammed up in like political infighting and discussion. So there's kind of a short window for them to try to get stuff through, or at least put markers out for what they want to do over the 4 years. So that's really what that plan is. As well, they wanted to really hit the ground running on COVID-19, given the urgency of the situation. So in terms of what I think is most achievable, I think some of the individual COVID priorities definitely are. I think the vaccine plan in terms of ambition to administer it, I think is absolutely doable. I think the supply issue is what's probably going to be the challenge on that. It seems like there wasn't a lot of careful kind of documentation of what vaccines went where in the previous administration, since it wasn't really a federal kind of plan. It was left to the states. So it really is just unclear how many vaccines are out there that haven't been administered and where those are. So that makes it harder to kind of prioritize distribution of them to areas that don't have enough. And then you might have areas that have too many vaccines that go unused and potentially even expire or aren't properly stored. So then they're wasted. So I think the challenge on that is going to be the supply. And then not even the supply of vaccines themselves is the associated supplies to administer them or to store them or to package them. So that's going to be another challenge there. So I think we'll have to see kind of what happens with that. I think what will be probably pretty achievable is some of the public education campaigns that they want to do. I think there probably is a huge appetite by the public for information. I think that was one of the challenges with the previous administration. One of the criticisms that I know President Trump received a lot of is that there just wasn't enough communication to the public. And so I think that's an area that's pretty ripe for just even using celebrities and spokespeople to kind of communicate the importance of vaccinations and safe procedures. I would say the other area that's in some ways easy is the federal mask mandate on transportation. In terms of jurisdiction, that's absolutely the federal government's jurisdiction. So it's straightforward in that sense. But how that's kind of enforced, I think, will remain to be seen and leaves a lot of challenges to the individual transportation vehicles and companies that have to somehow try to enforce it. I think in some ways, we've heard that whether it's the airlines or buses or trains, it will help them because they have something to point to. But at the same time, it might leave them in a tight spot because once they point to the federal rule, if a passenger still doesn't want to comply, it doesn't help in that sense. It doesn't add any more teeth. It just leaves the individual transportation to try to figure it out. Another question. Can a president really go around Congress suspending an X-waiver, which is a congressional mandate? That's a good question. So a lot of, when you have a law that is passed by Congress, in order to really change it from a bigger picture perspective, yes, Congress does need to act. That being said, on the regulatory side, you can make smaller changes and kind of chip away at it. This latest X-waiver change didn't get rid of it altogether, and it didn't suspend it altogether, which is why they can do something to that effect without a congressional mandate. But it probably is kind of ripe for potentially being challenged, whether in the courts or otherwise, that it goes too far in terms of changes to the X-waiver and the spirit in which Congress passed it. So I think that's kind of where the challenge is. And so I'm sure the Biden administration is looking both at it from a legal perspective and a bigger picture perspective. One thing we're trying to assess is if they intend to work with Congress to get rid of it altogether, in which case the guidelines that were put out last week aren't going to be necessary, because if there's no X-waiver, then you don't have to worry about guidelines on kind of changing the X-waiver to relax them a little. So we'll have to see what happens there. I thought I saw another question coming in. How are the ACEP relationships with new subcommittee leaders? Largely, they're good. We're in a good place, I think, in terms of being able to continue good relationships and the work that we do with these subcommittees. In terms of Dr. Burgess not being the Energy and Commerce Subcommittee Chair, while it would have been helpful since he's a physician, we've had a good relationship with Representative Guthrie, and he's always been very, I think, friendly to physician issues and pretty aware of some of the challenges that physicians face. So it's certainly, I think we'll still be able to work very well with that subcommittee regardless of that. On top of all that, both Dr. Burgess and Representative Guthrie, they're the ranking subcommittee chairs, so they're not in the majority. So while they're still very important to have a good relationship with, it's the subcommittee chair, which is Anna Eshu, which will be the most important relationship there. Do we know if there will be emergency physicians on any of the new task forces being assembled? So far, none that we know of, but we are definitely trying to work with the administration and emphasize the importance of having emergency physicians represented in some of this work being done, especially on COVID-19, given the key role that you all play in the pandemic. I mean, I think there's other physician specialties that are also critical in this as well, but I think emergency physicians and emergency response, plus serving as medical directors on the EMS side, it makes it a pretty, I think, easy case to put out there on having representation. So that's something we're working on. Good question. Is this buzzer beater style flurry of regulatory activity normal? Well, we kind of had two categories of flurries of regulatory activities. We had the flurry of regulatory activity with outgoing Trump administration in its final days. And that's normal in the sense that they want to get as many of their priorities out the door before they no longer are able to when they leave. So in that sense, it's normal-ish. I would say the Trump administration probably was willing to be a little more flexible in terms of adhering to statute and all the rules around that, and some of the short timelines that I mentioned in those last regulations are definitely probably subject to questionable review. And then you had the kind of second set of flurry of regulatory activity with the incoming Biden administration. And I would say that was probably on the higher end, but not completely abnormal. Again, I talked about the importance of the first 100 days. So usually, even before a presidential candidate wins an election, they'll have a transition team loosely in place, and they'll have a lot of transition advisors, and they'll start to come up with plans in case they are elected so that they can really hit the ground running during the transition between November and January when they are inaugurated. So all of that happened with the Biden administration. So it's not like they, got to work on January 20th and then did all this in 5 days, in the first 5 days. From the beginning. They've been working on this already for, probably a month and a half, 2 months, maybe even longer. So it's more just putting it into effect as soon as they can. And given the urgency around some of the COVID-19 stuff, I think that's why they're doing it all at once right at the beginning versus waiting, for example, until, let's say, an HHS secretary is confirmed by Congress. Question is, where do the telehealth changes stand? They were temporary, but will they become permanent? So on their own, they will not become permanent, but they are in place as long as the public health emergency is in place at all during that calendar year. So there's certainly, because we're already, the public health emergency still is in effect and we're in January of 2021, that means the telehealth changes will stand and be in place through the end of 2021 at minimum. Should the public health emergency extend at all into January of 2022, even just for 3 days, then automatically the telehealth changes will last through the end of 2022. It's hard to kind of judge right now if the public health emergency will still be in effect in January of next year. I think we all hope it won't be, because I think we all hope that by then vaccines will be broadly administered and we'll start to be getting towards herd immunity, if not achieved it by then. So I think that remains to be seen. In terms of becoming permanent, certainly we are working to make those some of those permanent. That's been something ACEP's been working on for years, and we want to see emergency medicine telehealth codes in Medicare permanently, and so that's something we'll be working on. Last question. Just coming in now. I keep hearing about this ACEP blog, Regs and Eggs. How can I read it? Sure. So Regs and Eggs is our blog from ACEP's Regulatory Affairs Director, Jeff Davis. and you can read it ACEP at acep.org/regs and eggs, the word and, so REGSANDEGGS. And there's a new issue every Thursday morning. So keep an eye out, and you can, if you go to that URL, you'll be able to look at some of the past issues as well. And it's a great kind of deeper dive into some of the regulatory stuff we talk about on the Capitol Minute. So if you're ever curious about some of that, you'll be able to read more there. So that wraps it up for today. Join us in 2 weeks, same time, same place, and we look forward to seeing you then. Thanks again.